You're about to learn the exact income limit you cannot exceed if you want free health insurance in 2026. Miss this number by even $1, and you could lose thousands in free coverage. Let me start with a number that could change your life. The average family health insurance premium in the United States is over $25,000 a year. That's more than many people spend on rent. And yet, millions of Americans pay $0 for their health coverage. They get full medical, hospital, and prescription drug benefits for free. How? They know the income limits. They know which programs to apply for, and they know how to navigate the system. Today, I'm going to show you exactly how to get free or nearly free health insurance in 2026 in the US, the UK, and Canada. By the end of this video, you will know the exact income thresholds, the application deadlines, and the step-by-step process to access coverage you may have been paying for unnecessarily. Let me start with the United States, where the rules changed dramatically starting January 1, 2026. For the previous 3 years, the federal government had expanded premium tax credits for the Affordable Care Act marketplace. Those enhanced subsidies expired at the end of 2025. Here is what that means for you. From 2026 onward, premium tax credits for marketplace health insurance plans are only available to individuals and families with household incomes between 100% and 400% of the federal poverty level. For a single person in 2026, 400% FPL is just under $63,000. For a family of 4, it's around $128,600. If your income is above that level, you get no premium tax credit at all. You pay full price, but here is where the opportunity lies. For those with incomes below 400% FPL, the government limits how much you pay for a benchmark silver plan. For a single person making 150% FPL, or about $23,000, your premium contribution is capped at 4% of your income, or around $90 a month. But for many low-income Americans, the cost can be zero. Now let me talk about the truly free option, Medicaid. As of 2026, 41 states and the District of Columbia have expanded Medicaid under the Affordable Care Act. In those states, adults with incomes up to 138% of the federal poverty level qualify for completely free coverage. For a single person in 2026, 138% FPL is approximately $21,597 per year. For a family of 4, it's about $42,000. That means if you are a single adult earning up to $21,500 in an expansion state, you pay nothing for health insurance, no premiums, low or no copays, full medical, hospital, and prescription drug coverage. But let me give you a critical warning. If you live in a non-expansion state, the rules are different. 10 states have not expanded Medicaid. In those states, Medicaid is generally only available to very low-income parents, pregnant women, children, and people with disabilities. Childless adults often fall into a coverage gap. They make too much for traditional Medicaid, but too little for marketplace subsidies. This is a serious gap in the system, and advocates are pushing for federal action. Now let me talk about CHIP, the Children's Health Insurance Program. This is the hidden gem for families. CHIP covers children in families with incomes too high for Medicaid, but too low to afford private insurance. In many states, CHIP covers children up to 200% or even 300% of the federal poverty level. Some states have income limits as high as 405% FPL. For a family of 4 with an annual income of $100,000, your children may still qualify for low-cost or free coverage through CHIP. In some states, premiums are capped at 5% of family income. That means a family earning $60,000 pays no more than $3,000 per year for all their children's health coverage, prescriptions, dental care, and vision services. This is a lifesaver for millions of us. Here is your action plan for the U.S. Step 1. Go to healthcare, Gov, or your state's marketplace. Create an account. Step 2. Enter your household income. If your income is below 138% FPL and you live in an expansion state, you will be directed to Medicaid. Apply immediately. Step 3. If your income is between 138% and 400% FPL, you will see premium tax credits. Compare the silver plans. The cost-sharing reductions, which lower your deductibles and copays, are only available on silver plans for people with incomes under 250% FPL. Step 4. Apply for CHIPS separately for your children if your income is too high for Medicaid. The application is free and takes about 30 minutes. And Step 5. If you lose your job or have a major life change, you qualify for a special enrollment period outside the normal open enrollment window. Do not wait until November. Apply the day your income changes. Now let me cross the ocean to the United Kingdom, where the system is fundamentally different. The National Health Service, or NHS, provides health care that is free at the point of use for anyone who is ordinarily resident in the UK. That means you do not pay for doctor visits, hospital stays, emergency care, or surgeries. There is no income test. There is no application. If you legally live in the UK, you are covered. But here is the part that most people misunderstand. While NHS care is free, there are charges for some services in England. Prescriptions cost about £10 per item. Dental treatments cost money. Eye tests and glasses are not free. However, there are huge exemptions for people with low incomes, certain medical conditions, and specific age groups. Here is where the real free coverage comes in. If you are a full-time student, a pensioner, or a person receiving certain benefits like universal credit or income support, you may qualify for help with NHS costs. The most powerful tool is the NHS Low Income Scheme. Under this scheme, you apply for an HC2 certificate. If approved, you get full help with health costs. That means free NHS prescriptions, free NHS dental treatment, free sight tests, and help with the cost of glasses and contact lenses. To qualify for an HC2 certificate, you must have weekly income below a certain threshold. As of 2026, if you receive universal credit, the income limit is £435 per month, or £935 per month if your claim includes a child element. If you have more than £16,000 in savings, you cannot get a certificate. But for low-income households, this program is a game changer. There is also the NHS Prescription Prepayment Certificate, or PPC. If you need regular prescriptions, you can pay a flat rate for unlimited prescriptions. As of 2026, a 3-month PPC costs around £30 and a 12-month PPC costs around £110. If you have more than 2 prescriptions per month, this is cheaper than paying per item. Now let me talk about a major change for 2026. The immigration health surcharge for most adults has increased to £1,035 per year. This is a charge for non-UK residents, including many immigrants and international students, to access the NHS. If you are on a work or student visa, you must pay this surcharge as part of your visa application. It is not free, but once you pay it, you have the same access to NHS care as a UK resident. Here is your action plan for the UK. Step 1. If you are a resident, register with a local GP practice. This is the gateway to all NHS care. Step 2. If you are on a low income, apply for the NHS Low Income Scheme online. The form takes about 20 minutes. Step 3. If you take regular prescriptions, buy a prescription prepayment certificate. It will save you money. Step 4. If you are pregnant, under 18, over 60, or have certain medical conditions, you automatically qualify for free prescriptions. Check the full list on the NHS website. Now let me finish across the Atlantic in Canada, where healthcare is provincial, not federal. Every province and territory in Canada has a public health insurance plan that covers medically necessary hospital and physician services. These plans are free for residents. You do not pay premiums. You do not pay co-pays for doctor visits or hospital stays. If you are a Canadian citizen or permanent resident, you are covered. But here is the critical gap that most Canadians do not understand. Provincial health insurance does not cover prescription drugs, dental care, vision care, physiotherapy, psychology, or ambulance services. Those services are not free. You either pay out of pocket or have private insurance through your employer. The average Canadian family spends over $2,400 per year on these uncovered services. However, every province has programs for low-income residents to cover these gaps. In Ontario, the Ontario Drug Benefit Program covers prescription drug costs for seniors and people on social assistance. For seniors, there is an annual deductible of $100, then a flat copay per prescription. In British Columbia, Plan C covers 100% of the eligible cost of over 1,000 prescription drugs for people on income assistance. In Alberta, the province offers extended health benefits for low-income residents, including prescription drug coverage, with copays capped at $35 per prescription as of April 2026. And for families with children, the Canadian Dental Care Plan is now fully live for all eligible residents with an adjusted family net income under $90,000. That plan covers basic dental care, including checkups, cleanings, fillings, and extractions. Here is your action plan for Canada. Step 1. Apply for your provincial health card immediately if you are a new resident. There is often a waiting period of up to 3 months. Step 2. If you have low income, apply for your province's prescription drug program. The applications are free and often online. Step 3. If you have children under 18, apply for the Canadian Dental Care Plan if your family income is under $90,000. Step 4. Consider purchasing private supplemental insurance for prescription drugs, dental, and vision if you do not qualify for provincial programs. Plans run from $70 to $200 per month, depending on your age and coverage needs. Let me give you 3 real-world examples of people who use these programs to get free or nearly free coverage. A single mother in Texas with 2 children earned $30,000 per year. Her children qualified for CHIP at very low cost. She herself qualified for a marketplace plan with premium tax credits that reduced her monthly premium to $20. If she had moved to a Medicaid expansion state, she could have qualified for free coverage for herself as well. A pensioner in Manchester, England, received universal credit and applied for the NHS low-income scheme. She received an HC2 certificate and now gets free prescriptions, free dental care, and free eye tests, saving her over £500 per year.